Hi there, and welcome to another episode of the English Shadowing Podcast, the place where you practice real-life English by listening, repeating, and learning how to use natural conversation in everyday situations. I'm so glad you're joining us today, whether you're sitting comfortably at home, walking through your neighborhood, or even commuting to work. I hope you're ready to practice and grow your English skills. Shadowing is one of the best ways to improve your pronunciation, rhythm, and fluency. All you need to do is listen closely and repeat what you hear. Try to copy the tone, the pauses, and even the emotion. In this episode, we're going to talk about a very important and practical topic: going to the doctor's office. For many English learners, this situation can be stressful. You might worry about not understanding medical terms or not knowing how to describe your symptoms. But don't worry. By the end of this episode, you'll know how to make an appointment, describe how you feel, and understand what the doctor might say to you. We'll cover lots of expressions and give you examples, so you can feel confident the next time you visit a clinic or hospital in an English-speaking country. Before we get into the details of doctor visits, I have a quick question for you. Have you ever visited a doctor's office in an English-speaking country? What was your experience like? Did you feel nervous, confused, or maybe proud because you were able to explain your symptoms clearly? I'd love to hear your story, so please share it in the comments below. You never know. Your experience might help another learner feel more prepared and less alone. All right, let's begin. Visiting a doctor can already be a little scary, even in your native language. But when you have to explain your pain, symptoms, or health concerns in English, it can feel even more challenging. That's why we're going to break it all down and practice together. We'll go through useful phrases, common questions, and responses you might hear at a clinic. Imagine this. You wake up feeling sick. Maybe you have a headache, a sore throat, or a stomachache. You know you need to see a doctor. What do you do first? Usually, you need to make an appointment, and that's where our journey starts. Making a phone call to schedule a visit. Let's start with how to make an appointment. If you're calling the doctor's office, the receptionist will usually answer the phone with something like, "Good morning, Dr. Taylor's office. How can I help you?" A good way to respond is, "Hi, I'd like to make an appointment to see the doctor, please." If you're not feeling well, you can add, "I've been feeling sick," or "I'm not feeling well." The receptionist might then ask, "What seems to be the problem?" Or, "Can you tell me what symptoms you're having?" This is your chance to briefly explain how you feel. You could say, "I have a fever and a sore throat," or "I've been coughing a lot for the past few days." It's okay if you're not sure what to say. Just try your best to describe how your body feels. You might also hear questions like, "Have you been here before?" or "Are you a new patient?" If it's your first time, simply say, "No, this is my first visit." This part of the conversation is usually short and polite. The receptionist will then offer you a time and date. For example, "We have an opening at 3 p.m. on Thursday. Does that work for you?" You can respond, "Yes, that works," or "Do you have anything earlier?" These are basic phrases that make your conversation sound natural and confident. Now that you've made your appointment, let's imagine it's the day of your visit. You arrive at the doctor's office, maybe a little nervous, but you're ready. When you walk in, the first person you'll usually talk to is the receptionist at the front desk. You can start by saying, "Hi, I have an appointment at 10 o'clock. My name is," and then give your full name. For example, "Hi, I have an appointment at 10. My name is Maria Lopez. The receptionist might ask you to sign in or show your ID or health insurance card. You can respond with something simple, like, "Sure, here it is," or "Do you need anything else?" Sometimes you'll be asked to fill out a form with your personal details and medical history. If you're unsure about a word on the form, it's okay to ask, "Excuse me, what does this mean?" Or, "Can you help me with this question?" Most people will be happy to help you if you ask politely. After checking in, the receptionist might say, "Please have a seat. The nurse will call you shortly." Now you wait for your name to be called. This part of the visit is usually calm, but it's still a great opportunity to practice your listening and speaking skills in English. Just before we go any further, if you're enjoying this podcast and finding these tips helpful, please take a moment to like this episode and subscribe to the channel. It really helps others discover our podcast, and it lets me know that you're learning and want more content like this. Plus, when you subscribe, you'll never miss a new episode, and we've got so many practical topics coming up. All right, now back to the doctor's office. After waiting a few minutes, you might hear a nurse call your name, "Maria Lopez." When you hear your name, just stand up and say, "That's me," or "Yes," and follow the nurse. The nurse will usually take you to a small room where they'll ask you a few questions before the doctor arrives. You might hear, "What brings you in today?" or "Can you describe your symptoms?" This is your chance to explain why you're visiting. For example, "I've had a headache for 3 days," or "I have a sore throat and body aches." Try to be as clear and simple as possible. The nurse might also check your vital signs, like your temperature, blood pressure, or weight. They could say, "I'm going to take your temperature now," or "Please step on the scale." These are normal parts of a checkup and nothing to worry about. If you don't understand something, you can always ask, "Could you say that again, please?" Or, "What does that mean?" Remember, it's totally okay to ask questions. You're there to take care of your health, and communication is key. After the nurse finishes the basic checkup, you'll usually be asked to wait a few minutes until the doctor comes in. When the doctor enters the room, they might greet you by name and say something like, "Hello, Maria, I'm Dr. Smith. How are you today?" A polite and friendly way to respond is, "Hi, I'm not feeling well today," or "I've been sick since Monday." The doctor will likely ask follow-up questions such as, "Can you describe your symptoms?" or "Where does it hurt?" This is where you can explain how you're feeling in more detail. You might say things like, "I have a sharp pain in my stomach," "My head has been throbbing," or "My nose is stuffy and I have a sore throat." If your symptoms started a few days ago, you can use expressions like, "I started feeling bad 3 days ago," or "I've had this pain since last night." It's helpful to use words that describe the type of pain or discomfort. For example, dull pain, burning feeling, pressure in my chest, or tightness in my back. If the doctor asks, on a scale of 1 to 10, "How bad is the pain?" try to be honest and say, for example, "It's about a 6." These kinds of details help the doctor understand what might be going on with your health. Don't worry if you're not perfect. Clear, simple explanations are the most important. At some point during your visit, the doctor might ask you about your medical history. They could say, "Do you have any chronic conditions?" Or, "Have you had any major surgeries in the past?" These questions help the doctor understand more about your overall health. If you don't have any, you can say no, I've always been pretty healthy, or I've never had any surgeries. But if you do have something in your history, be honest and clear. Yes, I have asthma. Or, I had surgery on my knee 2 years ago. The doctor may also ask if you're taking any medications. A common question is, are you currently taking any prescription or over-the-counter medicine? You can reply, yes, I take medicine for high blood pressure, or no, I'm not taking anything right now. Another important topic is allergies. The doctor might ask, do you have any allergies to medications or food? If you do, say, yes, I'm allergic to penicillin, or I get a rash when I eat peanuts. And if you're not sure, you can always say, I'm not sure, or I don't think so. Being honest and accurate helps the doctor give you the safest and most effective treatment. These questions may sound personal, but they are standard in every doctor's appointment and meant to help you get better. Once the doctor has listened to your symptoms and asked about your medical history, they will usually explain what they think is happening. They might say something like, it sounds like you have the flu, or I think you're dealing with a sinus infection. If you're not familiar with medical terms, it's okay to ask for clarification. What does that mean? Or, is that serious? The doctor might also explain how long your illness could last. This should clear up in a few days. Or, you might feel tired for a week or so. After giving you a diagnosis, the doctor will suggest treatment. This could include rest, drinking fluids, or taking medicine. If they prescribe medication, they'll say something like, I'm going to give you a prescription for antibiotics, or take 1 tablet twice a day for 7 days. Make sure to ask if anything is unclear. Should I take this with food, or are there any side effects? You may also hear, don't drive after taking this, or avoid dairy while on this medication. These are helpful safety tips, so always pay attention. If your condition needs more attention, the doctor might say, I'd like you to see a specialist, or we need to do some blood tests. Understanding what the doctor says will help you follow their advice carefully and feel better faster. Remember, you can always ask them to speak slowly or repeat something. As the appointment comes to an end, it's very helpful to ask any questions you still have. Don't be shy. Doctors are used to answering all kinds of questions, and it's important that you leave the office feeling informed. You can say, can I go to work or school while I'm sick? Or how long should I rest before exercising again? If you're unsure about your medication, try asking, what should I do if I miss a dose? Or, can I take this with my other medicine? These are smart and responsible questions. You can also ask about your symptoms. Should I come back if my fever doesn't go away? Or is it normal to feel tired with this illness? These phrases are natural and show the doctor that you care about your health. Before you leave, the doctor might give you a note for your school or job, saying that you visited a doctor and may need time off. This is called a doctor's note. If you need one, you can politely ask, would it be possible to get a note for work? Finally, they may say, let's schedule a follow-up appointment in a week, or call us if you're not feeling better in a few days. When everything is done, thank the doctor by saying, thank you for your help today, or I really appreciate your time. These polite expressions make the conversation feel complete and respectful. Before we go on, if this episode has helped you feel more confident about speaking English at the doctor's office, I'd love for you to take a quick second to hit the like button and subscribe to the podcast. It really helps our community grow and make sure you don't miss any future lessons. We cover topics just like this. Everyday situations that are real, practical, and full of useful expressions. Now let's move on. After your appointment, you may need to go to a pharmacy to get your medicine. The doctor might send your prescription directly to a local pharmacy, or they might hand you a paper to take with you. When you arrive, you can go to the counter and say, "Hi, I'm here to pick up a prescription. My name is." The pharmacist might ask for your date of birth or another form of ID. Once they find your medication, they may explain how to take it. Listen carefully for instructions like, "Take 1 pill every 8 hours," or "Use this cream twice a day." If something is confusing, don't be afraid to ask, "Can you repeat that more slowly?" or "Should I take this before or after eating?" It's also okay to double-check, just to confirm, "I take this once in the morning and once at night." Clear communication at this stage is very important. Understanding your medication is key to feeling better, and pharmacists are trained to help you with that. Let's take a moment now to talk about describing your symptoms more clearly. This is especially useful if you need to visit a different doctor, go to a pharmacy, or explain how you're feeling to someone who is helping you. Instead of just saying, "I feel sick," try to give specific details. You can say, "I have a dull pain in my lower back," or "I've been coughing non-stop, especially at night." If your symptoms come and go, say "It's on and off," or "The pain gets worse in the evening." You can also describe the intensity. "It hurts a little," "It's very painful," or "It feels like pressure in my chest." Time expressions are also useful. For example, "I've had this pain since Monday," or "It started last night." These small additions help medical professionals understand your condition more quickly and offer better care. You can also mention what makes your symptoms better or worse. Try saying, "It feels better when I rest," or "It gets worse when I eat." These are called triggers, and they're very helpful clues for a doctor. If you practice these phrases ahead of time, they'll feel more natural when you really need them. Being clear and calm helps you stay in control and gives the doctor a full picture of what's going on. Sometimes, going to the doctor isn't just about physical pain. You might also be feeling stress, anxiety, or sadness. It's completely okay, and actually very important, to talk about your mental health too. Doctors are trained to help with both your body and your emotions. If you've been feeling down, a simple way to express this could be, "I've been feeling really tired and sad lately." Or, "I'm having trouble sleeping and I feel anxious." If your feelings are affecting your daily life, say something like, "I can't concentrate at work," or "I don't feel like doing the things I usually enjoy." These are signs that your mental well-being may need attention. You don't need to use fancy vocabulary, just be honest and clear. The doctor might ask, "How long have you been feeling this way?" Or, "Has anything changed in your life recently?" It's okay to say, "I don't know," or "It just started a few weeks ago." If you're nervous, you can begin by saying, "This is hard to talk about, but I think I need help." That one sentence can open the door to real support. There may also be follow-up steps, like talking to a counselor or getting a referral. Mental health is part of overall health, and it's brave to speak up, especially in a second language. Now let's imagine a different situation. You're not going to the doctor for yourself, but for someone else, like your child, a parent, or a friend who needs help. This is very common, especially if you're a caregiver or a parent. If you're taking your child to the doctor, the receptionist or nurse might ask, What's the child's name? Or how old is your son or daughter? A good way to respond is, his name is Leo, and he's 5 years old. When the doctor arrives, they might ask you to describe your child's symptoms. You can say, he has a fever and isn't eating much, or she's been coughing and has a runny nose. You can also say, he says his ear hurts, or she woke up with a rash. If the doctor asks, has he taken any medicine? You can reply, I gave him children's Tylenol this morning. For elderly family members, you might say, my father has been feeling dizzy lately, or she's been confused and more tired than usual. In these cases, it's helpful to bring a list of medications they're already taking or write down their symptoms before the visit. You're acting as a voice for them, so being clear and organized helps the doctor do their job well. And don't forget, you can still ask for clarification at any time. Can you explain that again, please? Or, is this medication safe for children or older adults? Sometimes your visit doesn't end with just one appointment. You might need to come back for a follow-up, see a specialist, or get some tests done. These steps can feel confusing at first, but don't worry. With a few helpful phrases, you'll be ready. After your exam, the doctor may say something like, I'd like to schedule a follow-up in 1 week, or let's check your progress in 2 weeks. To respond, you can say, that works for me, or ask, can I make that appointment at the front desk? If the doctor wants you to see another professional, they might say, I'm going to refer you to a specialist, or you'll need to see a dermatologist for that. You can ask, do I need to make the appointment myself, or will they call me? When it comes to tests, such as blood work or x-rays, the doctor might explain, we're going to do some tests to learn more. Or, I'll call you when the results are ready. If you're unsure, you can ask, how long will it take to get the results? Or, will someone call me or should I come back? After you leave, don't forget to ask the receptionist, do I need to schedule the follow-up now? Or, can I get a copy of today's visit summary? These small questions can make a big difference and help you stay organized. It's totally okay to take notes or ask them to write things down for you. Before we move on, if this episode is helping you feel more prepared for real-life doctor visits, I'd love it if you take a moment to like this podcast and subscribe to the channel. It truly helps our community grow, and it lets me know that you're enjoying these practical shadowing lessons. Plus, when you subscribe, you'll never miss out on future topics like job interviews, phone calls, or visiting the dentist, all important, everyday moments. Now, let's talk about urgent or emergency situations. Sometimes you might need to see a doctor quickly. For example, if you have a high fever, sharp pain, or an accident. In these cases, you might go to an urgent care clinic or the emergency room. When you arrive, you can say, I need to see a doctor right away. Or, I think I need urgent care. The staff may ask, what's the emergency? Or how long have you been feeling this way? Try to be calm and clear. I've had chest pain since this morning. Or, I fell and hurt my ankle badly. If you're with someone else, you can speak for them. My friend passed out. Or, my son is having trouble breathing. In emergency settings, people may speak quickly, but you can always say, I don't understand. Can you explain that again slowly? Emergency situations are stressful, but having a few prepared phrases can help you stay strong and get the help you or someone else needs. Let's now explore a situation that's becoming more common. Speaking to a medical professional over the phone or through a video call. also known as telehealth. These types of appointments can be very helpful when you can't visit in person, but they also require clear communication. When the nurse or doctor calls, they might begin with, "Hello, this is Nurse Jackson from City Health Clinic. Am I speaking with Anna Rivera?" A polite response would be, "Yes, this is Anna," followed by, "Thank you for calling." The healthcare provider may ask, "Can you tell me what's been going on?" Or, "What symptoms are you experiencing?" Just like an in-person visit, you can describe your condition by saying, "I've had a sore throat and fever since yesterday," or "I'm feeling very weak and dizzy." Because they can't see you physically, it's extra important to use descriptive language. Try using words like sharp, burning, tight, or aching to explain your discomfort. You can also be honest if you're unsure. "I don't know exactly how to describe it, but it feels uncomfortable here." And point if it's a video call. If they give instructions over the phone, repeat them back to confirm. "So I take one tablet every 6 hours, right?" This helps avoid confusion. Don't forget to ask, "Will I need to come in for a test?" Or, "Can you send the prescription to my usual pharmacy?" Whether it's a phone or video call, these conversations are just as important as in-person visits, and being prepared will help you stay calm and clear. Let's take a moment to talk about something very important: what to say when you don't understand something during a medical visit. It's completely normal to feel overwhelmed, especially if the doctor uses complex words or speaks too quickly. The good news is you don't need to pretend to understand. You can politely say, "I'm sorry, I didn't catch that. Could you say it again, more slowly?" Or, "Can you explain that in simpler words?" These small requests show that you're paying attention and want to be sure. Another helpful phrase is, "Could you write that down for me?" This works especially well if you're being given instructions or the name of a medication. If you feel confused about what's happening, try asking, "What does that mean?" or "What should I do next?" These questions help you stay involved in your care. You can also be honest and say, "English is not my first language. Can you please speak slowly?" Most doctors and nurses will appreciate your honesty and will try to help. If you're feeling nervous or uncomfortable, it's okay to say, "I'm feeling a little overwhelmed," or "I'm not sure what to expect." Expressing your feelings clearly helps the medical staff take better care of you. Remember, your health is important, and asking questions is not a weakness. It's a strength. The more confident you become in saying these phrases, the more control and comfort you'll feel during any kind of appointment. Let's now look at a situation that many people experience: going to the doctor for a checkup or regular health exam. Even if you feel fine, it's smart to visit a doctor once a year just to make sure everything is okay. This kind of visit is often called a physical or annual checkup. When you arrive, you can say, "I'm here for my yearly checkup," or "I have an appointment for a routine physical." During this kind of visit, the doctor might say things like, "Let's check your blood pressure," or "I'll listen to your heart and lungs." You may also hear, "I'd like to order some blood work just to make sure everything looks good." Don't be surprised if the doctor asks questions about your lifestyle, like, "How often do you exercise?" or "Do you smoke or drink alcohol?" Just be honest. This helps them give you the best advice. You can also use this time to bring up any small health concerns you've been wondering about. Try saying, "Lately, I've been feeling tired. Could that be something I should check?" Or, "My back hurts a little after work. Is that normal?" These kinds of questions are exactly what checkups are for. If you're not sure what to ask, prepare a short list before your appointment. You can also say, "I don't have any major concerns, but I'd like to stay healthy." Doctors appreciate when patients take preventive care seriously. It's one of the best ways to stay on top of your health. And now, you know exactly how to talk about it in English. Now, let's talk about something many people find confusing: paying for the doctor's visit and dealing with insurance. When you arrive or leave the doctor's office, you might be asked, "Do you have insurance?" Or, "What's your insurance provider?" If you're not sure, you can say, "I'm not sure," or "Can you help me understand?" The receptionist may explain what your insurance covers or what costs you need to pay. You might hear phrases like, "There is a copay of $20," or "Your insurance covers this visit fully." If you need to pay, you can ask, "Can I pay by credit card?" Or "Is it possible to get a receipt?" Sometimes the doctor's office will bill your insurance directly, and other times you'll pay up front and get reimbursed later. If you have questions, try saying, "Can you explain my bill?" Or, "Who do I contact if I have questions about insurance?" It's normal to feel overwhelmed by these details, but using simple, polite questions can help you get the information you need. Don't hesitate to ask for help or clarification. Understanding how payment works will make your visits smoother and less stressful. The more you practice these phrases, the easier it will feel to handle this part of your healthcare. As we come to the end of today's episode, I want to say a big thank you for joining me on this journey to feel more confident and comfortable at the doctor's office in English. Remember, every step you take to practice these phrases and expressions helps you communicate better and take control of your health. Whether you're describing symptoms, asking questions, or understanding instructions, you're building important skills that will make your visits easier and less. Found this podcast helpful? Please don't forget to hit the like button and subscribe to the channel. That way, you won't miss any future episodes that are designed to help you with everyday English situations. Also, I'd love to hear from you. Please leave a comment sharing your own experiences at the doctor's office, or tell me what topics you'd like to hear about next. Your feedback helps make this podcast even better. Until next time, take care of yourself, keep practicing, and remember, your health and your voice matter. See you soon.